dressing and the tape. I have already torn my tape, which you should do before you even assess the patient. You can also take out your dressing, peel it, and lay it backside up. On the side that you think that you're going to be using the hand. Take out your tourniquet. And the tourniquet is the first impression that you give the patient how well you are doing the procedure. If you fumble putting on the tourniquet, then they're going to wonder, how well can they start the IV? By the way, what I've seen of your tourniquets, you need to practice that and be a little more proficient. I have actually assessed both arms and have already chosen this as my site. I then will alcohol it and ChloraPrep. Alcohol, and I still go with circling. Leave just a few minutes. And then ChloraPrep. And I know that the new version now is back and forth, but I still... Now, the reason why we don't put on our gloves until now is because when you are looking for the site, you need the tenderness of the finger and feeling and palpating those veins. So the gloves should not be put on until now. And I'm going to be using, as you can tell, this is a yellow hub, which means it's a 24 gauge catheter. And when I take it, I pull it apart. So now I have tourniquet assessed. I have chosen the site, alcohol, ChloraPrep, put on my gloves, and now then I will do the catheters prepared with the traction. Now when you are using traction, especially with the hand, you can go below the knuckle. If you go up high, your angle is going to be hindered with your thumb. So I'm going to go below the knuckle, and I actually rest my finger here. It's an angle, traction, angle, stick, and dip. And can you see the flashback? Immediately when I got a flashback, I drop the angle, then I thread the catheter to the skin and pull back. Now, you have a choice, especially here. I can leave this hand with the traction keeping it, or I can choose to lay the hand down and keep this hand and let this hand get the dressing. And the dressing goes right up to the hub. It's a little off-center.
Make sure the hub is stable.
And really, once it's put on, and you want to walk around the edges to make sure that it is intact. Take off your tourniquet. Now, there are two things that I need to do with two hands. One of those is to loosen this catheter, and that oftentimes takes two hands. You don't pull it out, you only twist it. That breaks the seal. The other two-hand thing is to take off the cap of the extension, and I put it in my fingers. Now then, at the end of the catheter, you want to put these two fingers to stop the blood flow. Then the thumb and the index finger grabs the hub, you loosen it, push the catheter in. Now once the catheter is in, I can let up with those two hands and lure lock my extension in place. Normally at this point, you will then pull back just a little bit. that means I've really got a good IV. Doesn't necessarily mean if you don't get a flashback that you are in, but it gives a good indication. Then you need just to push enough fluid to rinse the extension, then get ready to positive pressure it by putting one thumb here, you push, and you close the clamp as you are pushing. So then you can no longer push. At this point then, remove the syringe and get ready to tape. Now, at this point, because tape is sometimes, everything now is, you're not going to have any more blood, you can take off your gloves. Gloves do not work well with tape. So once you have the catheter in and the transparent dressing on, you can take off your tape. The first tape doesn't need to be very long because it's just underneath the hub. There's the tape under, the tape over, so you walk up, you walk down, the tape J, and again, you can walk up, you walk down, and then put your J in place, and secure the tape. And then the fourth is tape the extension. The extension should be taped away from the transparent dressing. You do not want to tape, that's why you don't want a big J. You want to tape the extension up here on the arm. The clamp then can be unclamped and clamped. You also have the ability to place a IV push or even hooking up an IV line without disturbing the site. Once you have tape under, tape over, tape J, tape the extension, the next one is clean up the mess. Of course, I've kept kind of cleaning up as I've gone. And then you document. You document time, date, time, site, size, attempts, and then your signature.